So I don't think that we as a veterinary community have moved or changed fast enough to realize that the old standards of care are outdated and that we need to do better by pets.
What are the top 3 reasons that pets are euthanized?
What am I going to allow them to give? What does my dog really need? What does my cat really need? Know your answers and have your backup. No, this is why I'm not doing this, but thank you. Do you want to give your dog a toxin every single month for its entire life? That has to have a cumulative effect. And as an ER doctor, I see it having immediate effects all the time because I see them in there for seizuring right afterwards.
What type of advice would you give pet parents to make informed decisions in emergency situations, especially where the veterinary staff might be putting pressure on them to make a certain decision?
So it's okay for you as a pet parent to say, can I do one test at a time and then move on? And then say, if you're going to add another treatment to my dog, just let me know before you do. I trust you, but I just want to be a part of every decision. The owners, the guardians who I see suffer the most are the ones that are like, I want to do everything because I want to be the best guardian I can. So whatever you recommend. And those are the ones that get hurt because they end up doing too much.
Welcome back to the Next Level Pet Parent Podcast, a place where we unveil expert tips to help you raise healthy, long-living pets while taking you behind the scenes of the pet industry. Thank you so much for tuning in today. Your dedication to your pet's well-being is exactly why we're doing this and exactly why we're continuing with this podcast. If you have ever faced an emergency situation with your pet, you know how overwhelming that can be. Standing in the vet's office, trying to make the best decision about your pet's treatment while feeling that crazy pressure. It's super tough, and situations like this can be extremely uncomfortable, which is why it's so important to prepare ourselves and know how to handle these situations when they arise. Today, we've got Dr. Lynda Loudon with us, an integrative emergency veterinarian with over 22 years of experience. Dr. Loudon has seen it all, from life-threatening emergencies to chronic health issues that just don't seem to go away. In this episode, we'll dive into the troubling decline in canine health, why the current standard of veterinary care may not be enough, and most importantly, how you can become your dog's best health advocate. Dr. Loudon will share what questions to ask your vet, how to stay calm in stressful situations, and tips on how to take control when it really matters. This is an episode you really don't want to miss, so let's dive in. Thank you so much, Dr. Lynda Loudon, for being a part of our Next Level Pet Parent podcast today. We are super excited to have you on. And I do want to say, first of all, thank you so much for all that you've done in the last 22 years. I am sure being an emergency vet for 22 years is extremely difficult mentally and physically. Both. So can you please just start by telling our audience a little bit more about yourself and what it is that you do as an emergency vet?
Sure. Thank you so much for having me today. I'm so happy to be here with you guys. So I've been really blessed to have this career. I always wanted to be that person that could be there when the pets really needed me most. I wanted to be the one that could make the biggest difference, right? And so for me, being an ER vet has never really felt stressful. It just, I think that having the intention of helping those pets helped me just overcome that stress. It was never a stressful job for me. It was always just really I just felt purposeful, and it's just been an honor to be there for pets when they were in that critical state. So it's been a wonderful career, and I just wouldn't do anything different.
Yeah, it's a very difficult job, I think, to just be there for pets in emergency situations. So that's amazing that you're saying that it actually has been very fulfilling and very not that stressful for you. So
Yeah.
I think you have to be very mentally strong for that. for sure.
I think so, and it can be sad,
Yeah.
right? There's those days where there's more sadness, and we leave thinking, with now new memories that are hard. But most days there's so much good, right? And if we can try and focus on the ones that we could save and the ones that do get a second chance, and being able to also show up there for the guardians when they need us most, right? They're dealing with a traumatic event sometimes that they didn't expect that's how their day was going to go. And to be there for people in that place is also a privilege, So you do feel, even if things didn't always go the way you wanted to, you leave the day feeling you made a difference,
Yeah.
right? Even if it's just support
That's
for
beautiful.
those parents. Yeah.
That's amazing. And just to dig a little bit deeper into your career, were you working as an ER vet in a hospital, or where did you start, and where did you kind of progress?
Yeah, so I came out of vet school. I initially wanted to be a surgeon. Surgery is one of my favorite places to be, is in surgery. But I was an ER tech before going to vet school. And so I had an ER mentor in vet school who kept pulling me into the ER and saying, "You belong in here." And I'm like, "All right, I'll come help out, but I need to get back into surgery." And, by the end of vet school, I was like, "Okay, yeah, this is my thing. You're right." And so I still got to do trauma surgery, which is great. So I still got to spend a lot of time in the OR. And then I got out, I did an internship in emergency medicine. And then I stayed at that referral clinic. Um, my first real job I was to be in the ER at a new referral and emergency clinic here on Long Island. And I ended up running that ER and being chief of ER for 9 years.
Oh, wow.
And and then I ran an internship program, which was another love. I got to help new grads to learn the ways of the ER and get their feet wet, which was an honor too. And yeah, I came out of ER for 1 year in general practice, and that was not my place. And I went right back. And yeah, and that's just, and then I do relief now, because now I'm more online, trying to spread education to guardians.
So, over the last 22 years, I can't even imagine how many cases or different types of cases you have seen. So, my question here is, what are some of the most significant changes you've observed in pet health and care practices over the last 22 years?
To be honest, I don't think there's enough changes.
Mm.
I think that the veterinary practice, the standards of care are too slow to change. Um, I think the changes I'm seeing are in the pet parents who are demanding more. There's more holistic veterinarians now, especially online, and the natural pet movement, feeding fresh food, and people realizing what we're doing is significantly negatively impacting our pets. And the pet parents are onto that before the vets are, right? And not to say vets are bad, right? Because they're my associates. I have so much respect for vets. It's not an easy job. It's not easy to become a vet, and it's not easy to see patient every 15 minutes. And
Absolutely.
you've got multiple body systems to know and understand and be able to manage. You're the dentist, you're the ophthalmologist, you're the euthanasia vet. It's hard. It's a hard job. And when we get out of vet school, and I'll say this for myself, is I didn't feel I had to worry about nutrition because I had a rep that came and said, "Here, there's one for kidneys, there's one for liver. That's all you need to know." And when I was a new vet and I had all of this on my plate and a lot to learn, I was like, "Okay, well, that's one thing I don't have to worry about. Oh, you have a kidney disease? You just need this bag of food." It didn't take me long. I'm a very intuitive healer, and it didn't take me long to be like, "Okay, I'm not healing with that. If I really want to heal these animals, I need, and nutrition is just one example of it. That as vets, we didn't get enough of it in school, and we also were influenced by who was in the vet schools, who was supporting the vet schools financially, and how we were being educated. And when we come out, we get the lunch and learns to further, put that into our minds of why we should be feeding certain foods or recommending certain foods. So, as vets, I think there's a little bit of we're in this bubble and not seeing that the negative effects of these diets on our patients. And I think that we also, maybe some vets have a little bit of defensiveness that they maybe know that they should know more about nutrition. And so there's a resistance there. And that's just my personal perspective, opinion. So I don't think that we as a veterinary community have moved or changed enough, fast enough, to realize that the old standards of care are outdated and that we need to do better by pets.
In human medicine, we have all these specialists. We have a human nutritionist, we have the general doctor, we have the dentist, exactly. We have what's the skin doctor called? Dermatologist, and all these different specialists, cardiologists, and in veterinary medicine, a lot of the times one person has to do it all. And especially when it comes to pet nutrition, a lot of pet parents think that their vet is the place to go for pet nutrition advice. And it's difficult because, yeah, on one hand side, that might be true. But on the other hand side, there's also qualified pet nutritionists that actually make that their profession or specialize in it, right? So yeah, that's definitely a shift that we see as well, but also still a lot of pet parents do rely on the advice of their vets to give pet nutrition advice.
And I think it's up to the vet to say, I'm not that person for you, and be okay with that, because we have so much pressure to be everything to every single pet parent. I think that is how that's the future, right? For the vet to say, actually, I'm not the best resource for your dog's nutrition, but here are 3 numbers to 3 nutritionists that you can reach out to, or let me get our nutritionist that's on board here in the clinic to come in and talk to you about nutrition. Have their techs, go through nutrition qualifications, certifications, so that they can say, oh, I've got another appointment to get into. Nutrition takes more than 3 minutes to discuss with you, right? Which is what we try to do. We're trying to, even like puppy care, your vet is not your puppy behaviorist. You can't go into your vet and expect them to go through everything you need to know about bringing this puppy home. What you need to do, then go over vaccines, preventative care, nutrition in a 15-minute visit. And so we need to stop, as the vets, putting all that pressure on ourselves. Let some of that go to other people who are better qualified. And the pet parents have to also think common sense. You wouldn't go into your MD and expect in 15 minutes they're going to go over every single thing that you're going to need for a holistic or a whole centered wellness plan.
So true.
I'm wondering, why is it that way? Like, is it a problem with the structure of the veterinary healthcare system? Like, why would it be that we see a lot of veterinarians not necessarily making the recommendations to have your pet go see a canine nutritionist? Because they do exist. We know that they exist. But could it be that maybe a lot of the veterinary clinics might be owned by commercial pet food companies? You'll see so many veterinary clinics and they'll have a big logo of the pet food company that's sponsoring this clinic. Like, they're clearly sponsoring the clinic. Why do we see this issue?
I think it's 2 things, right? I think it's, one, that problem, right? The affiliations with the big kibble companies that are, whether they're getting discounts or whether they're getting a piece of it, whatever's going on in the back end in those partnerships, then that's playing a role, right? The more dog food they sell in their clinic for them is benefiting them in some way. The other thing is lack of nutrition knowledge and knowing that that is the correct way to do things, right? Because most vets are still brainwashed to think that an ultra processed diet is the best that you can do for your pet,
Hmm.
instead of knowing that speaking with a nutritionist and talking about fresh food and talking about raw and gently cooked diets and knowing that that is going to support health. It seems common sense when
Hmm.
you say it out loud. We wouldn't eat the same box of cereal for every single meal our entire lives and expect to thrive. We wouldn't do
Hmm.
that to our kids, but yet we're believing people tell us, even as vets, that people tell us that that's what we should do in order for our pets to thrive.
Hmm.
And the vets are still believing that. So that's why they're not going to recommend that nutritionist.
So, in the last 22 years of your experience being an ER vet, what are the most significant changes that you've observed when it comes to pet health and the differences in like what people need ER vets for? Has that changed today compared to 22 years ago?
For sure, yeah. Um, Even when I was young, I grew up raising dogs, showing dogs. We expected our dogs to live 16, 18 years, and that was the norm. And now I see a patient come through the door that maybe is 10, and I'm like, we're in double digits now. Is it going to be something bad if they're coming in my ER for something sick? Am I going to find a tumor? Where I wouldn't be thinking that in a 10-year-old dog 22 years ago when I started. I'm seeing so much obesity. I can tell a dog coming through my door if they're on dry kibble or if they're a fresh food dog. I can
Wow.
see their coats, I can see their body shape,
Hmm.
the dull coats, the whites of their sclera of their eyes,
Hmm.
if it's bright and glistening versus not.
Hmm.
Their teeth, their gums, I can tell what they're eating.
Hmm.
And so these dogs are obese. They're getting fed these ultra processed diets. It's causing chronic dehydration and inflammation. And then I'm seeing them earlier and earlier for these chronic diseases, these hypothyroidism, all of the other endocrine diseases, Cushing's disease, diabetes, dogs getting arthritis symptoms earlier.
Hmm.
And as a euthanasia vet, I see that so much. And it's heartbreaking because there's these dogs that are mentally ready. They're ready to keep living their lives, but they can't walk because they've been obese, because they've been dealing with chronic inflammation their whole lives. And now it's beyond my help.
Hmm.
And I see dogs' lives, their longevity decreasing over the years, increase in chronic diseases, um, allergies are out of control, and cancer is, euthanasia. I'll get 4 hemangiosarcoma patients from my euthanasia business a week.
Wow. Wow.
Horrible.
Wow.
Wow, that's crazy.
Hmm.
And like when you started, how
I would
often
see,
would you say would you
yeah, I
get
would
that?
say hemangio. I'd maybe see once a month,
Hmm.
Wow.
maybe twice a month at the most when I first started.
Yeah.
And now, a pit bull at 10 years old walks through your ER clinic not feeling well. You're like, oh,
Hmm.
where's the hemangio?
Wow.
That's such a crazy statement because to you, cancer is happening so much that you have enough experience to instinctively possibly know what the illness is within that animal.
Yeah.
Cancer is happening that much
Hmm.
more today than it was 22 years ago.
Yeah.
And even I would say, like with, it's not like the knowledge isn't out there as far as how many pets are being diagnosed with cancer. Because even maybe, I guess maybe like 5 years ago, when we started on our journey, we actually started our journey on researching pet cancer. One in
Hmm.
two dogs 5 years ago were getting diagnosed with cancer over the age of 10. And I think today they're saying that more dogs are getting
Hmm.
cancer with that data being out there
Hmm.
before. So it's what are your thoughts on
And we
this?
don't even know
Mm-hmm.
truly because it's not a reportable disease.
Mm-hmm.
We really, I was just talking to my husband, who's also a vet, the other night. Like, I'm like, well, how can we get us, vets reporting things,
Mm,
reporting this chronic disease, reporting the allergies, get the AVMA to make that mandatory in clinics and reporting the cancer. So we actually have real statistics. A lot of the research is looking back at records,
mhm.
right? But let's report them so that we can really have a better grasp on what's going on.
Wow. I actually didn't know that a lot of the cases are not even actually really being reported.
Yeah. Yeah. Like
Mm.
if a human gets cancer, that's reported, but
Mm.
not necessarily not in a dog. It's not required.
The crazy thing with cancer in particular is that there's also studies that show that about 90% of cancer is preventable. So I mean, we actually have another podcast episode on that topic as well with Julianne Lee from Adored Beasts. It's just absolutely insane, like the research that's coming out on that as well. From your experience as an ER vet for 22 years, you mentioned that the dogs and cats are getting sicker and sicker and chronic diseases on the rise. So, what would you say, in your opinion, are the top three contributors to that?
Diet, like we've talked about, I think that's main, right? If we want to live a healthy lifestyle and live as long as possible, nutrition is the first thing that we have to do. So these ultra processed diets, being the only thing that they get their whole life, causes this inflammation. Their gut microbiome, where 70 to 80% of our immune system lies, is in terrible shape. And then they come in for a symptom, and then we're putting drugs right into them right away without looking at the gut microbiome and supporting that. And so we're making things even worse with all of these chronic drugs that we're using just to cover up the outward signals that something's going on. Over vaccination, I think, is a huge problem and really upsetting for me as an ER vet. Um, I left for a year to go into general practice, like I'd mentioned, and it was for a corporation. And I didn't know anything about preventative care. I didn't do it. I came out and went right into the ER. So I was sat in front of a computer like all of the other employees in front of experts about each vaccine, and why, if I didn't give all of these vaccines, I'm risking these animals' lives. And I knew intuitively, giving this Maltese who's 10 years old sitting on someone's lap for vaccines, I'm hurting that dog. I know that. And it didn't make sense. I didn't last very long there. And so when I went back to the ER, it was even clearer to me. These patients I'm seeing in so many allergic reactions. And these patients, the allergic reaction dogs, those are the patients 3, 4, 5 years later down the road. I would say to them, don't vaccinate your dog again. He's had one allergic reaction. He can't have vaccines again. But they'd go back and their vet would say, oh, we'll just give Benadryl before next time.
Wow.
And so these dogs would go another few years of inducing this inflammation on the inside, but masking the symptoms on the outside with the Benadryl. And then I see them for immune-mediated hemolytic anemia or immune-mediated thrombocytopenia, where it's life-threatening and sometimes I can't save them. And I know that that is what caused it. And so I see so many of those cases in the ER, so many allergies from these dogs getting over-vaccinated year after year, vaccines that they don't need. I see puppies. It's a little bit more rare, but awful when it happens. These little puppies come in, their breeders have vaccinated, over-vaccinated, started too young, and then they go to their general practitioners. They get 3 or 4 more rounds. They've wiped out all their gut flora with all of the dewormers, and then they come into my ER with no cell lines left from their bone marrow, and I can't save those. And if I save them for a few weeks or a couple months, they'll still succumb to it.
Wow.
And that's heartbreaking because we did that to those puppies.
And just for our listeners and our viewers, we are definitely not saying don't vaccinate your animal. We're just saying to be conscious of over vaccinating your animal. Do you want to speak a little bit more on
That's a
that?
good point. Yeah.
Yeah.
I mean, vaccines save lives
Hmm.
for sure. Um, when we talk about vaccines, core vaccines, that's
Mhm.
your rabies, your distemper, your parvovirus, and those are important to protect your dogs against.
Mhm.
But they need 2 rounds.
Mhm.
Every of my patients that I've checked after 2 rounds of vaccines with a titer have titered and been protected. They don't need 3 and 4 rounds. These puppies are sometimes getting 5 rounds.
Mhm.
And then after that, they don't need vaccines every year.
Mhm.
Every 3 years or titer, which is better. And a titer is where you test their blood and you make sure that they're protected against that virus. Non-core vaccines, I personally don't recommend them.
Mhm.
That's your lepto, your Lyme, Bordetella, which is kennel cough. And, that's a whole other podcast. But,
Yeah.
um, and I have, a blog on that. You can go to
Mhm.
drloudon.com and read about the core and non-core vaccines. But we don't get vaccines every single year for our entire lives. Our kids
Mhm.
don't, but we're doing it to our dogs. And even though now the recommendations are every 3 years, some veterinarians are still doing it every year.
Mhm.
Going from your experience as an ER vet for 22 years, what is right now, today, what are the top 3 reasons that pets, no matter if it's a cat or a dog, are euthanized?
Hmm. Cancer, I would say, is number one. Immobility, because they arthritis that's progressed. A lot of people wait too late. They don't notice the subtle signs of arthritis, and they don't realize that they can manage it. They just think that it's just natural part of getting old. So those dogs miss out of that window of where we could really manage their arthritis and help them live longer. Um, and then chronic disease, the kidney disease, the liver disease, adrenal
Mhm.
issues, any of these endocrine problems, diabetes where they progress to the point where they can't really manage it anymore.
Our French bulldog had IVDD, an injury, a mild injury, thankfully. But it just hit home when you said immobility, because I see, like, after she was diagnosed with IVDD, we went into Facebook groups and stuff like that, and I saw how many pets actually get euthanized because of this, because you know, it's it was honestly, it was so sad and so mind-blowing to me to see, because thankfully our dog had a very mild injury, which I wholeheartedly believe is because we've taken a proactive preventative approach for 5 years before she got the injury. So,
Mhm.
and it's also interesting that you just mentioned that, there are things that we can do to proactively help prevent arthritis or joint concerns to progress to a point where it has to become a reason for euthanasia. Maybe not in all cases, but
Mhm.
there is so much we can do. And I have seen so many people online saying, like, there's nothing we can do.
Mhm.
It's once they have it, they have it. Or, so
Right.
it is actually really good to hear from you as well that there's so much that we
There's
can
so
do.
much you can do. And you think about these big dogs, right? Because it's more important for them as they get older for us to be able to manage them if immobility becomes an issue. So if they're out there exercising, they're eating fresh food, they're at their lean body weight, they've got muscle, you're working on their core, they've got a strong core because you're doing those long walks, they're
Mhm.
sprinting, they're swimming, and you're supporting their joints with omega 3s and natural anti-inflammatories. And then, okay, they're older now, but you've got a head start. This dog has a strong core. It's going to hold him for a lot longer than that obese dog whose immune system is already suffering, and now arthritis is just another thing, you know, pushing him down.
Mhm.
So, what are three actionable ways that pet parents can do to enhance their pet's health and longevity?
So just some 3 simple ones that they could do right now is,
Mhm.
if you're feeding kibble, replace some of that with some real food, right?
Mhm.
Sardines, great for omega 3s, great for vitamin D. I order sardines from Amazon. You can get them fresh, which is even better.
Mhm.
But easy. Order them on Amazon, no salt added,
Hmm.
and get it in water,
Hmm.
right? And just add a can of sardines to your dog's meal instead of some kibble. Replace it with eggs. My dogs get eggs almost every day.
Mm.
Great amino acids. It's a great protein source. Omega-3s again, vitamins, blueberries, antioxidants. Just add something fresh to their bowl. And if your dog is only fed kibble, then you have to be careful, right? Add one thing at a time,
Hmm.
slowly, because their gut microbiome's not ready,
Hmm.
right? So I would say your second thing, or maybe should be your first thing, is check your dog's gut microbiome
Mm.
and start working on that.
Hmm.
Start repairing that gut microbiome so it's ready for fresh food.
Hmm.
Test it. Animal Biome is
Hmm.
one company, VDI Labs is another,
Hmm.
where you just send out for the test, Animal Biome. They'll send you a kit, some poop, send it out to them,
Yeah.
and they'll give you a printout for what's going on with your dog's microbiome. Does it need more beneficial bacteria?
Hmm.
Is there an overgrowth of the bad bacteria? And they'll give you advice on how to start to manage that. It might be fecal transplant,
Hmm.
which they can supply. Legacy Biome is one where it's freeze-dried poop that it sounds
Yeah.
awful, but it's really awesome, and it really
Hmm.
can transform your dog's health, where they put it in capsules and you give it to your dog, and it's from healthy dogs that have a really great gut microbiome. It's a
Hmm.
really great way to start that foundation for your dog if they haven't been fed fresh food.
Hmm.
So fresh food, test the microbiome, work on the microbiome. I have some blogs on that, like fermented foods to add, kefir,
Hmm.
um, plain yogurt, all great for the microbiome. Your dog might need some soil-based probiotics for a little while to get them back on track.
Hmm.
Get them out in the soil. That
Yeah.
is one of the best things you can do for your dog's health, their well-being, and let them dig in your yard. you know,
Yeah. Yeah.
that's my excuse when my husband's like, they're digging again. I was like, they just increased their longevity, babe.
Yes. I love it.
So yeah, get them out in the soil and work on that microbiome. And then, yeah, I personally think that well-being, like emotional well-being,
Hmm.
is something that we don't pay enough attention to for our dogs. We have all the stress about what should I feed, what supplements should I get. They just want your love
Hmm.
and connection. And that is something you can easily do that's going to help you. Get on the floor with them every single day. Get out in the forest for those long walks, the forest bathing that's going to be good for your well-being and your dogs. And make sure that your dogs, if you have a particular breed type, which I was a trainer before I was a vet, so that's important to me too, is I see so many people come through my clinic where there's a separation in their bond with their
Mm.
dog. And it may be that they've wanted a breed because it was a cool breed and they didn't think about their instincts.
Hmm.
And so now we're annoyed that this dog is exhibiting its natural instincts that we bred into him for years and years and years.
Yeah.
And so make sure you understand your dog's breed type and that you're giving them the time and the opportunity to express those instincts. Like us, like we want to live a purposeful life.
Hmm.
Purpose-filled life, that's where we have our real true happiness. Same for our dogs. They need that purpose, some more than others. Like maybe your bulldog doesn't care much about its purpose. Maybe that's, eating,
Eating is her
right?
purpose.
Right? Maybe it's just being connected with their owners on the couch,
Hmm.
right? But get that connection with your dog. See them for who they are and how they express their needs, because a dog's misbehavior is them expressing a need that is missing.
Hmm.
And then we get frustrated because of what we're actually not doing for our dogs, and then that bond starts to break. That's why dogs end up in the shelters. That's why dogs get crated too much, because we're not connecting with them. And the whole point of us keeping our dogs as healthy as possible and around as long as possible is to experience more joy with them
Yes.
and more connection.
Yeah.
And so make that your number one priority.
That is such good advice, because it really, like, every dog is so different, and what works for one dog doesn't necessarily work for another dog. And especially when it comes to behavior and playing and stuff, like our Frenchie, like, she just she couldn't care less about like a toy that I throw for her. But like if we rough play with her, like she loves that.
Hmm.
Or like if I hide treats for her, she loves that. So it's just really about like finding what works for your individual dog.
Yeah, be creative and try
Hmm.
different things. Like
Mhm.
we often value adventure, right? If we're doing different things and trying new things, dogs do too.
Hmm.
That lights them up. So be creative and it's fun for you too.
Yeah,
Mhm.
absolutely. Okay, before we jump back in, I need to tell you about something that is truly changing the game for dog moms everywhere. You know that feeling when you're trying to make the best decisions for your dog, whether it's nutrition, training, or just overall wellness, but there's just so much conflicting information out there. That's why I'm so excited to share the Dog Mom Society from Dr. Lynda Loudon. It's not just a resource, it is a community designed to give you the expert guidance and support you've been looking for. As a member, you'll get access to weekly live Q&A sessions with Dr. Loudon and other canine experts, plus monthly deep dive training on key topics like behavior, holistic health, and nutrition. If you need personalized advice, members also get discounted one-on-one consultations with Dr. Loudon as well to help you navigate any health concerns or optimize your dog's care. But here's what really sets this program apart. You're not just getting expert advice, you're also joining a safe, encouraging community for dog moms just like you and I. A place where you can ask questions, share wins, and connect with others who truly get it. No judgment, no overwhelm, just real support to help you and your dog thrive. So if you're ready to level up your dog mom game, click the link in the show notes or visit podega.us/dogmom to get one free trial month. Trust me, you'll be so glad that you joined. All right, now let's jump back into this episode. All right, so let's take it back again to the ER and emergency veterinary visits. What type of advice would you give pet parents that are listening to make informed decisions in emergency situations, especially in situations where the veterinary staff might be kind of putting pressure on them to make a certain decision?
My advice first would be prepared before something happens, right? Kind of get that knowledge so that you're an informed pet parent, so that some of the things that might come up, that you have some knowledge about it. And you're going to feel more comfortable making decisions around these things like medications, uh, asking questions, right? Antibiotics. Does my dog really need that antibiotic? What is it for? Ask specific questions. And a knowledgeable vet, a confident vet, is not going to have a problem with your questions. If they do, that's a little bit of a red flag that they're lacking a little confidence, right? If a vet is not willing to say, I don't know, I don't have every answer. And if I don't know your answer, I'll say, no, but let's find out, right? If a vet is going to give you just some kind of answer, you can tell that. So ask specific questions. If you coming into an ER and your dog has to be brought in the back. Now, in a general practice, I don't love dogs being brought in the back. I want to see what's happening with my dog. I want your dog to stay with you where they're connected and feel safe. Once in a while, we'll get a dog whose behavior, usually Chihuahua, who's better without their owner, right? Because they're going to defend them.
Mhm.
They
Yeah.
feel like, oh, I'm their only protector, so
Mhm.
they'll love me in a different room. And sometimes I'll just be in a room right next to them and be like, I'm right here.
Mhm.
He's better with me.
Yeah.
But I think for guardians and their dogs and their cats, most of the time they're better in the room together. And you want to see how your dog's being handled. Is it in a fear-free way?
Mhm.
And what is being done, right? If you're in a general practice, it's not the ER, but if they're getting a vaccine, I want you looking at the bottle and the little sticker of what vaccine your dog's getting.
Mhm.
If your dog's getting injectable meds, look at it. What
Mhm.
injectable meds are they getting? So when you go in, ask the questions. Don't be afraid to ask specifics. Ask for an estimate. In an ER, you want to know what you're spending
Mhm.
because it can go pretty high pretty quickly, and it's your right to know what you're spending. Just say, I just want an estimate of what we're doing. Um, and then when they give you an estimate, ask what meds are going to be given to your dog and the reason for it. And that's
Hmm.
it. That's not asking too much. And then if they recommend a diagnostic test, great. We do need diagnostic tests, and that is a frustration for an ER doctor if you refuse those when I really need them, right? But maybe you do one at a time,
Yeah.
because sometimes I'll do a radiograph. I don't need my ultrasound. So it's okay for you as a pet parent to say, can I do one test at a time and then move on? And that ER doctor might say, actually, no, because sometimes I do need them all at once
Hmm.
if I'm trying to save the dog's life,
Yeah.
right? But if it's not life threatening, maybe one at a time is okay.
Hmm.
So these are some questions you can think about. And then if your dog's hospitalized, some important things: bring your own food if your dog's on a fresh diet.
Okay.
You don't want an otherwise healthy dog that's now had a trauma is in the ER to now get a processed diet to heal,
Hmm.
right, during the time that it's most important. And then say, if you're going to add another treatment to my dog, just let me know before you do,
Okay.
right? If they're going to add another injection, if anything changes, I trust you, but I just want to be a part of every decision, if that's
Hmm.
okay.
Hmm.
And you should be a part of every decision.
Hmm.
Thank you so much. Those tips were so amazing and so incredibly important because, like, as a pet parent, even in our situation, like Larry and me, we know so much about pet health, but at the end of the day, in emergency situations, we don't know what to do, right? A lot of the times, and that's why we're going to a vet. We want to get the professional advice because it's very important to do what's right for the dog. But then in a lot of situations, we're not sure, like, okay, is this the right thing to do right now? Is this, and even Larry and me, we are a lot of the times afraid to ask things, or we are made to feel like we shouldn't be asking these things. But we've been in so many situations where, like, we stood up for Milka and we actually did, you know, ask, okay, is this an emergency right now, or can we go get a second opinion? And it's so important to know how to have respectful conversations with veterinarians, no matter if it's in the ER or not. But like, it's so empowering to know what to ask for and what to
Hmm.
do, because it's so scary. It can be so
It's so
scary.
vulnerable,
Yeah,
right? You're in a very
exactly.
vulnerable spot.
Yeah.
Exactly. Yeah.
And
Just to add to this, something I think would be very beneficial for listeners and the viewers that are watching this is to maybe go into these meetings with a notepad or write in your phone.
or record it.
Or exactly, or
Yeah.
record it, like, so that way you can go back to it and you can research it, because I think sometimes I would say that even we have been in situations like, what did they say? Oh, I don't remember. You really do want to have that information so that you can go and research, that was the medication that they gave. What are the side effects? Because sometimes, we've been in situations where we said, okay, what's that medication? And we asked the veterinarian, okay, what are the side effects? And the veterinarian doesn't actually know, so like we want to have that information so that we can, you know, reflect on it or research it.
Yeah. And usually if you're going into the ER, you're
Hmm.
not going to take everything in, right?
Yes.
Because you're thinking about your dog that's in the back.
Hmm.
And
Hmm.
and so is a really good point. Can I mention one other
Yeah.
one?
Hmm.
I just have a feeling, I feel like I have to mention this one. Hemangiosarcoma.
Yes.
The ones that come in that are bleeding in their abdomen. Hemangiosarcoma is a very common cancer in dogs right now. It's most often on the spleen, and we don't know it. I've lost two dogs to it. Dogs who I knew were predisposed because of their breed, who I ultrasounded every 4 to 6 months as they aged and still didn't see it
Wow.
before they ruptured, because that's the nature of it. The tumor comes and we don't know. There's no outward symptoms until it starts to bleed.
Wow.
And so these dogs come in after a collapse or weakness, and we find that they're bleeding into their abdomen. Now, often owners are only told the only options for this dog are surgery to remove the spleen, emergency surgery, or euthanasia.
Mm.
Now, depending on the case, sometimes that may be so. Some dogs are too far gone to consider anything else. Age is something to consider too. Is it a 14-year-old dog with hemangio, or is it a 10-year-old dog? But a lot of hemangiosarcomas can be managed holistically with Yunin Bio, which I always say wrong, but for months and even up to a year. And I've even heard of 2 years in the rare instance. So I do feel people give up on hemangio a little bit too soon. I just felt I wanted to say that if you're in the ER, you get that diagnosis, just take a minute, take a minute, take the dog home and say, let me just take the Yunin Bio and take my dog home and think about it overnight. And if I have to get a home euthanasia vet, I'll do that, right? If surgery is not what you want to do.
We know we have had a few cases where pet parents have come to us for support for this cancer, and we do know that turkey tail mushrooms actually helps to extend the life of dogs, specifically with hemangiosarcoma. So dogs that are supplemented with this supplement can actually live longer.
Yeah,
So there's
yeah, that's
studies
another great one.
for this.
Yeah, there's a lot you can do for hemangio. And turkey tail and the Yunin Bio are two that are really great for it.
Yeah, I think in general, getting second opinions as well, or, taking time to think, especially also before you mentioned antibiotics and things like that. So I think pet parents can always ask the vet, is this a life-threatening situation? And if it's not a life-threatening situation, then, we have some time to consider a second opinion or other options as well.
When it's down to euthanasia, right? If your dog, and they're saying, okay, euthanasia would be the best option for your dog, and your intuition is like, oh, I don't think that my dog's ready. Listen to that intuition. Say, what else can I do just to manage my dog's symptoms, my dog's pain for right now while I sit with this? Is it possible to manage my dog's pain in this state with what's going on so that we can just sit with this?
Yeah.
Because that's a very, very big decision. And you don't want
Absolutely.
to make that decision under duress in a state of where you don't have a moment to think about it.
So true. Yeah. Thank you for adding that. All right. So personally, I am extremely passionate about first aid. Larry's laughing because I'm too excited about it, I think. Having a first aid solution at home, a natural first aid solution and plan makes me feel so powerful at home. Like, to just help my dog right then and there when she needs it, while I try and decide, okay, is this something that I have to go to the vet for? Or even just to give her something that helps calm her down, or helps to relieve pain, or helps to relieve swelling while I'm on my way to the vet. So it's just, I have had so many situations where like Milka got bit by a bee and her face swelled up, and just having something natural at home that helps her right then and there has helped me save vet bills, but also helped me feel empowered and be ready for anything, basically. So what are your favorite holistic first aid remedies that you think every pet parent should have at home?
The ones that I'm constantly recommending and that I use, right, to friends and pet parents would be just for cuts, any cuts that might come up, dilute betadine. I use that on my kids, I use it on us, I use it on the dogs. If there's an open wound, dilute betadine, a nice light tea color, is really great to have in your cabinet. And then pat it dry, and some manuka honey is really great remedy because it's antibacterial, it's antifungal, it's a really, a hot spot with some dilute betadine and manuka honey, it'll clear up, within a day or two. It's really good to have. For diarrhea, I think plain psyllium husk, plain organic psyllium husk is my go-to. And my dogs get psyllium husk in their meals every day just to keep nice firm poops and avoid diarrhea, because I have dogs that like to get into anything they can find in the yard. but I will double up on that psyllium husk if I get a loose stool. Canned pumpkin is in my cabinet for them. Canned organic pumpkin, not the pie filling, but just straight pumpkin. Great source of fiber for them if they have loose stools. Nettles are great for any bee stings, things like that. Those are all good ones to have. CBD oil.
Yeah.
That's really great because you mentioned calming, right?
Yes.
That's a good one that if I have people coming over for a party, my dogs are all getting double doses of their CBD calm, right? Because I'm not just going to knock them out with a sedative that's going to mess with their microbiome. I'm just going to help something that's natural, can take the edge off for them. And that's something if you have to take your dog to the vet, give them that before you get in the car. And then CBD is just also good for so many things. So it's good to have.
Yeah. Yeah, it's also one part of our holistic wellness and first aid kit. Like we use the CBD when, actually we take it with us wherever we go because we travel so much with Milka and just to keep her calm. And then also we use it for joint health because it's so great.
It's great for joint health. And for joint health too, because we talked a lot about arthritis. I love green-lipped mussels because there's such a high concentration of omega-3s and they have glucosamine. So I've had dogs where, glucosamine, the green-lipped mussels with eggshell membranes, which is also really great natural anti-inflammatory, and turmeric, and turn them around. So those are really great natural pain relievers to have at home, good for joints.
Yeah, absolutely.
Ginger is
Awesome.
good for nausea. A little
So
ginger
true.
tea.
Yeah, so true. Larry can attest to that.
Yeah, I mean, I absolutely love, turmeric. It's like one of my favorite herbs in the world because this has so many health benefits, like not only for inflammation, but for like anti-cancer properties, like so many. And that's the thing, with all of these foods, a lot of the times you're not only addressing one thing, you're going to get so many health benefits in other areas of the body. So yeah, they might reduce inflammation, but they're also good for skin health. They're also good for brain health. They're also good for so many different
That's
things.
so neat, like when you say that, right?
hmm
Because when you think about the other drugs that we use, they're targeting one thing, but they're bad for everything else.
Exactly.
Right?
Yeah.
Where you're picking natural solutions where you're actually benefiting other things instead of worrying about what am I harming.
Exactly.
Absolutely.
Yeah. With the drugs, it's like, okay, like just as you said, you're addressing one concern, but now you may be creating other concerns. Now you need to possibly, if you work with the vet that you're working with, they might just prescribe you another drug for that. And it's just a cycle,
It's a
So, but with
vicious cycle.
food, it's just like it's just a whole food approach, and it benefits a lot of the times the whole body.
Yeah.
Do you have any specific case that you can share a little more about that also demonstrates on how important it is that pet parents are empowered with knowledge about their pet's health?
Yeah. I have a lot of sad stories. Those are the ones that stick with me. Like I could just remember every single thing about them. And one of them, and I've shared this one before, was a cat, a 16-year-old cat. The owner brought, the cat was 16 and she said, her thoughts to herself was, I just want him to live as long as possible. I want to make sure I'm doing everything. And I'm sure we can all relate to that, right? We've all felt that, like we're holding on to them.
Yeah.
And she's like, all right, she hadn't vaccinated him since he was a kitten, which is fine because he was an indoor cat. She's like, only other things she noticed, he was living his best life, except he was maybe a little hungrier, maybe a little thinner, otherwise doing great, loving life. Took him into the vet. He got 4 vaccines at the same time. Had never been vaccinated for 16 years now. And the vet, rightfully so, drew some blood because he had some chronic symptoms and he was an older cat. But sent that blood out, so we had no results, but still gave the vaccines before we even knew. And we knew that he had symptoms of chronic disease, right? Hyperthyroidism in cats, those excessive eating, but still losing weight. He was in my ER within 12 hours after receiving those 4 vaccines.
Wow.
And his white cells were depleted. He was not oxygenating. Became anemic and just depleted, collapsed. And I spent the entire weekend, 14 hours a day, trying to save him.
Wow.
And Sunday came and I had to tell her, I can't save him.
Wow.
And watching that owner slide to the floor
Mm-hmm.
and remembering the look on her face when she realized,
Yeah.
did I do this?
Yeah.
Right? I made that decision. I took him to the vet.
Mm.
And I think that's the most heartbreaking. I get goosebumps because it's the most
Yeah.
heartbreaking part for me.
Yeah.
You know, it's sad that cat's life was cut short. He was enjoying his life. But this owner's left behind with guilt about this and now without her cat. And so know what you're going for when you go into the vet. Like, am I going in for vaccines? What am I going to allow them to give? What does my dog really need? What does my cat really need? And know your answers and have your backup, right? Have your knowledge. No, this is why I'm not doing this, but thank you. This is why I'm not doing this, but thank you. You know, do you want those pesticides in and on your dog every month, these commercial pesticides that they're going to push on you?
Yeah.
Do you want to give your dog a toxin every single month for its entire life? That has to have a cumulative effect. And as an ER doctor, I see it having immediate effects all the time because I see them in there for seizuring right afterwards. So have a health plan for your dog. Maybe have a holistic vet that's going to help you with that plan. I do those plans for you too, where you know what every age, what your dog really needs, what you're going to do to support their health and avoid disease instead of banging them with all of these drugs and vaccines and causing chronic inflammation, and often not knowingly. You think you're doing, like, the owners, the guardians who I see suffer the most are the ones that are like, I want to do everything because I want to be the best guardian I can. So whatever you recommend.
Yeah.
And those are the ones that get hurt because they end up doing too much. And those dogs and cats end up suffering for it. And then the guardians suffer.
Which is, it's so heartbreaking because like we all want the best for our pets, and like we talk to so many pet parents who feel guilty about things that they've done or decisions that they've made that may have contributed to their pet's health declining. And we always say, like, you cannot feel guilty about this because you always, as a pet parent, you always acting out of a place of love. You always believe that in the moment that you're doing things, you're doing it because it's going to help your pet. And you will never make a decision that might harm your pet. So there can never be any guilt. It's just a learning experience that we unfortunately sometimes have to go through. But it's like, it's so heartbreaking when we hear these stories of pet parents who have so much guilt. Yeah, what would you say to pet parents like that?
I'm a pet parent like that. I've made decisions that I know my dogs would have lived longer if I had made a different decision. And so I know it. But as a euthanasia vet, I have an intuitive perspective where our dogs aren't feeling cheated that we didn't get the right treatment. We didn't get their nutrition right. I truly feel that our pets feel differently about death. They're okay. They're okay. And if you can let some of that pain go, you'll feel them. Let that guilt go. You'll open yourself up to feel them. They're still with you. And they're not over there going, damn it, why didn't she get me that treatment? Or why didn't she get my nutrition right? All they feel is your love all the way to the end. And they feel it now. So you have to let that go. And you have to say, okay, well, what am I going to do now to make sure that the pet that's in front of me now, I'm going to do my best. And that's all you can ever do. That's all any of us can ever do. And we all carry so much shame for things that if we had known better, we would have done better. And now we do. And now we have to look forward. And if we keep looking back, we're going to bring that past and that energy into the pet that you have now. And then you're going to hold on too tightly to that pet. I see owners all the time that come into the clinic, and I'll walk into a room and I'll feel their energy. And I know that they're holding guilt, or they're holding too tightly to this dog. Maybe because of what's going on in their life, or their cat too. They're holding too tightly, and they're so worried that they're going to make a decision. They're so worried that there's something's going to happen. And I see it in the health in the pet. I see it translate. It's overflowing into them. And so we have to get that straight so that we can support our dogs in the best way possible. And they just want our love. That's what we have to get right.
Yeah.
And everything, and learn as much as you can. We'll talk about my dog mom side. That's one way you can learn. Have support. Make sure you're getting your advice from trusted places, not from the Facebook groups, not from Google. And maybe not everything that you need for your dog is going to come from your vet. Maybe you need that nutritionist consultation. You need that holistic healer or a holistic vet that you're going to call for that second opinion. If you have a holistic or an integrative vet that can be your primary vet, even better.
Yeah. Absolutely. Thank you so much for sharing that. That means a lot. Yeah. And one thing I did want to add as well to something that you've said earlier, you said before we go into the vet office, we should know what we're willing to do and what our dog needs. And for anyone listening that might be in the beginning of their wellness journey right now, it can be very overwhelming to think that we have to know what we want to do with our pet's health and stuff like that. Because at the end of the day, a lot of the pet parents that are listening might be thinking, okay, but I'm going to the vet to tell me what to do, not the other way around. So, but if you thought that, what we mean by this a lot of the times is also to just kind of like have your trusted sources, just what you mentioned just now, have your trusted holistic sources that you could go to for second opinion. So like, for example, if I go to my vet and my vet says I need to give my dog a vaccine or an antibiotic or a flea and tick treatment, and my first question would be to ask, okay, is this a life-threatening situation? Is this an emergency? If it's not, then I have time to get a second opinion, or I have time to think about it and, see if that's actually something that I want to do. So yeah, I just wanted to clarify that for like pet parents who feel overwhelmed right now.
Yeah, I know it can be overwhelming. It can be annoying too. Like why, like you said, I'm paying the vet for this. But for our children, we would go in there with some empowerment and as their advocates and say, what are you giving? Why are you giving that? So we do have to do that for our dogs. And not because the vet is not trusted. I don't want to make it sound like we're saying vets can't be trusted.
No, definitely
I think
not.
vets are awesome.
Yeah.
Not just because I'm one of them, They work really, really hard. They really care. And some of the advice they're giving is not because they know that it's not the best, right? Whether it's kibble or vaccines, whatever. That vet who vaccinated that cat, he was an older vet, and he truly felt he was doing best for that cat. He was, 80 years old. He wasn't trying to rack up his bills, to get more money. He truly felt, but I really feel that I have to protect that cat because that's what he was taught.
Yeah.
And so for you as the pet parents going in there, just to have some empowerment within yourselves to be that advocate, to ask the questions and make more informed decisions. You can still rely on your vet to be there for that care, but just be part of the decisions, be part of what's going to happen there.
Yeah, absolutely. And just like you said, I mean, honestly, I can say from my own experience, having a vet that you trust is also so empowering as well. Like I wish that someone, like everyone can feel what that feels like, because I know what it feels like to not have a vet that I necessarily trust, but I also know what it feels like to have an amazing vet that I wholeheartedly trust. So,
Yeah, so look
yeah,
for that,
yeah,
right? If you
exactly.
feel like maybe this isn't my vet,
Hmm.
well, keep looking.
Exactly.
Yeah.
Yeah. So you mentioned earlier already, you mentioned the Dog Mom Society. So can you tell us a little bit more about what the Dog Mom Society is and why you launched it?
Oh, thank you. Yes, I started the Dog Mom Society, which is a membership for dog guardians. We've got some dog dads in there too. But I really wanted to empower guardians with this knowledge. I wanted them to have that safe space where they can come, where they could have access to me and other experts in the field that are trusted, that are more holistic and natural, that they can come to their questions, they can gain that knowledge so that they are more empowered and that they can be their true dog's advocate and also get that support from like minded dog guardians, right? Because not everybody just is as attached or in love with their dogs as we are. And it's nice to be in a space where people get it.
Yeah.
They get it. Like you want to go the extra mile. I do too. And I learn from my dog moms every single week. We have a pack chat. It's a virtual Zoom, and I look forward to it every week. We sit and we talk. We talk about our dogs. I might be like this week, I was reading a urinalysis for somebody. I was helping somebody got fleas, and we were dealing with that. But then we talk about each other's, and women wellness was a topic this week, and supporting each other. And it's become more than I ever imagined. It's a beautiful community. And then the dog moms, we do a monthly live training with some of the canine experts. Most of them are my friends, right? Rita Hogan, herbalist, came in and did a free training. Angela Ardolino from CBD Dog Health. We have Isla Fishburne coming in January. Love her, one of my new favorite friends, who's an amazing dog communicator and just spiritual guide. And my dog moms could really use that, just about what we were talking about, because there's a lot of guilt in there.
Yeah.
There's a lot of shame about, I don't want to make any mistakes. And I don't want to, still holding on to past grief. And I think Isla's going to really just be so wonderful for them to let some things go and connect on a deeper level with their dogs. And Noelle Feuder, my friend, behaviorist from Switzerland, who is also, I just met with her yesterday. She was in for the weekend, and we got to sit and talk about how she's going to become part of Dog Mom Society and really make behavior and training a key part of it and
Nice.
support dogs at even a higher level. So that's Dog Mom Society.
That's amazing. It sounds so awesome. Like a community of like-minded pet parents or dog moms and dads. That's really awesome.
And
Yes.
getting the professional support I think, is just top notch, amazing.
Yeah, and I have amazing certified nutritionists in there and holistic pet coaches as well as vets. So it's a mixture of all the things that we would need to keep our dogs the healthiest.
That's amazing. That's awesome. So, what's next for you and the membership?
Next is with Noelle.
Okay.
We really want to bring her in so that we can not only do the health, but I really want to work on our bonds with our dogs and talk about behavior and make sure that we're um, paying attention to their emotional wellness. And with Isla coming in too is going to help us with that. Make sure we understand what our dogs really need, that we're giving them the health, we're giving them the right food, and we're not causing any harm, which is huge in our group. Like, what are we going to stay away from so we don't cause harm and we don't have that guilt?
Yeah.
But then how are we going to enjoy our dogs to the ultimate level, right? Because they're here for such a short amount of time. And I think that's on purpose. Just personally, I feel every dog has guided me in a different way that's come into my life. Every dog has made me a different person. They've taught me a different lesson. And I think that that's on purpose, that they're only here for a short while. But how can we truly, truly enjoy them and have them enjoy our love and our time together as much as possible? So that's what we hope to bring into this new year. And in the fall, we're going to have an in-person retreat, a wellness
nice.
retreat for the guardians and their dogs, so that we can get to spend some time in person.
That sounds amazing too.
Yeah.
Wow. And where can everyone find you if they're interested in working with you or joining the Dog Mom Society?
Yeah. So my website, drloudon.com. We're in the middle of transitioning my website into Kajabi. So we're moving our website, but my blog is still at drloudon.com, so that you can look up, search any topic that you want. I probably have at least one blog on it. So that's free information that you can get. You can find me on Facebook, Dr. Loudon. And you can also find me at drloudoncanine.com. And that's where you can find about my memberships. And I have an experts academy for canine experts too.
Awesome. So we'll be sure to drop all of these links into our description section so you can find that easily.
Thank you. Thank you so much.
Thank you so much, Dr. Loudon, for joining us today. This was really such an amazing talk, and I've learned so much. I know.
Me too.
Yeah. So, yeah, thank you so
Oh,
much.
thank you. This was great. I love it. I could do this another 2 hours.
Yes, me too, actually. Thank you all so much for watching today's episode. If you're ready to level up your dog mom game and join the Dog Mom Society, click the link in the show notes or visit podega.us/dogmom to join with our exclusive offer just for our podcast listeners. See you in the next episode.